And then I think we will go on with the next part of the program with our keynote speaker of this afternoon or evening. Good evening, Professor Nakamura. And thank you for joining us. And we have a little bit a different format than usually, in the sense that first Anneke and Professor Nakamura will start a conversation, yes. And then based on that, Professor Nakamura will give the keynote lecture.
Yes.
Welcome. Thank you very much.
Yes, Professor Nakamura, welcome.
Yeah, hello.
And,
yeah,
we had some contact about yes. your keynote speech.
Yeah.
And I've prepared some questions for you, and okay. You will answer them in your keynote speech.
Yeah.
So I will mention it for the audience. I ask you for what is actually the added value of the additional MCH handbook for all the specific parental groups. And the second question was, regarding your parental population in Japan, are there any specific other parent groups that we need to address with an MCH handbook? And in the presentation of Mr. Bando, we saw an additional MCH handbook for parents with babies with Down syndrome. And the question is also, where do we focus on, and is there need to focus, and where is the limit in this? We can't make an MCH handbook for every syndrome.
Mm-hmm.
And the third question I prepared was, the WHO has also asked us to work on an MCH handbook that can be used worldwide. And they want to have input from the Netherlands and from a lot of other countries, I suppose. And this is, of course, wonderful. We can work together to combine all common knowledge and insights. But however, we also see a possibly problem in applying one uniform MCH handbook in each country. Yeah. Then after all, national care is differently organized in all countries. And how could we support the implementation to uniform MCH handbook when the context is so different in each country? So I gave you the questions, and I'm very curious about your keynote speech. So please, the floor is yours.
Okay. So thank you very much, Anneke-san, and I'm very glad and so several days ago, I received the question from Anneke-san, and so I consider how to answer the questions. And so now, okay. But I would like to make a photo, show you several photos by getting the inspiration from photo video method. And that's why, so I would like to show you some slide. Based on the Anneke-san's questions, okay? Yeah. Oh, this is okay.
Yes.
Yeah. Okay. And I think, but so. This slide is finally last night. So we decided that Anneke-san asks 3 questions first, and I will answer as a whole. So I am very pleased to finalize our collaboration works and with Anneke-san. And while this is the first challenge, but so I'm a little bit so nervous now. This is the first time challenge for me to make a keynote presentation in a style of answering the question. Yeah. Okay. And next, this is a question 1. First question: what is the added value of additional MCH handbook for specific parental groups? So I would like to start my presentation about a photo of the Indonesia before MCH handbook start. In Indonesia, when I worked in Indonesia in 1980s, This is also style of the house. A mother took care of her child in the house where there were no books, only mother's card and child growth card were available, but they were very frequently lost. Mothers take care of children very hard, but there are no records. This is my experience in Tinggi Raja in North Sumatra. After that, Indonesian government started MCH handbook by simplifying many forms in Indonesia. Government of Indonesia, and we worked with the government of Indonesia. And at that time, one of the very important tasks of MCH handbook was how to simplify many forms into one book. There were many cards distributed in Indonesia, such as child growth chart, including also immunization record, and the mother's pregnancy card, and some university or some donors added child development card, and additional nutritional poster and pamphlet. There are so many cards. And in the first trial of MCH handbook distributions in Central Java province, mothers and health volunteers preferred this MCH handbook, buku kesehatan ibu dan anak, bahasa Indonesia, bahasa MCH handbook. Mothers and health volunteers preferred very much because they are worried about too many cards distributed to only one child. This is a real situation. After that, after MCH handbook program was spread nationwide, I met one mother and two boys enjoy to utilize their own MCH handbook in Lombok Island in 2010. The fact that parents can manage medical and health record by themselves is a starting point for health participation. It was wonderful to see the mothers and the children brought their MCH handbook to their health examination in Indonesia. They would like to manage their health information by themselves. So they cherish their own MCH handbooks very much. And such a ownership is a very important key factors for the sustainability of MCH handbook. This is parents treasure MCH handbooks for a long time. I learned these things from Professor Azrul Azbar. I would like to introduce the late Professor Azrul Azbar, a professor of public health, University of Indonesia, and Director General of Community Health, Ministry of Health, Indonesia. And he was a board member of International Committee of MCH handbook. Professor Azrul Azwar said to me, MCH handbook in Indonesia has a different role in Indonesia. He said, when parents keep their MCH handbook, they can communicate their concerns to health professionals. This is a very important. That's why the MCH handbook empowers parents. MCH handbook are often the only one book available at home. I visited so many houses, and only MCH handbook is the only one book at home. That's why MCH handbook empower, especially the mothers in the case of low educated parents. In many countries, beautiful posters and pamphlets are displayed at health centers or hospitals. However, when a mother cooks at home, she cannot remember the information about nourishing food that is displayed on the wall of health centers. When MCH handbooks are kept at home, parents can easily read it anytime. This is very important. And I add so one slide because of the discussion about the special MCH handbook empowers parents in special needs. Bando-san already mentioned Shizuoka Little Baby Handbook. This is the English version, and Chinese, Korean, Spanish, Vietnamese, Portuguese, and Filipino versions are already you can download from the Shizuoka Prefecture's website. And so these things, such a special MCH handbook is empowers parents in special need. So that this is that's why. So I think so such a little baby handbook are expanding around the world. And after this is a take-home message about question 1. This photo is school children were dancing with songs how to wash hands for health promotion to the community as a festival of Kericho district in Kenya. Another one is children of the kindergarten, Taman Kanak-Kanak Bahasa Indonesia, Indonesian language, in Lombok Island, Indonesia. The children in the kindergarten were very active to enjoy their lives. I feel that the socio-economic situation is different of these two places. Socio-economic situation, ethnic group, and religion are different in each country, but atmosphere of children is quite similar in the world. Mothers and children around the world wish to enjoy health and well-being. So I strongly hope MCH handbook, sometimes MCH handbook is a special needs MCH handbook, also may empower parents and promote health and well-being of the children. This is my message. Second question is we cannot make a MCH handbook for each syndrome, one presume. This is a very hard question. Okay. There are too many childhood disease. This is a Center for Disease Control and Prevention, USA, CDC, list up many diseases for parenting information. So many diseases. And I was a neuropediatrician. So I have met children with various kinds of chronic disease and children with disability. So it might be impossible to make a MCH handbook for each disease one by one. I think so there are two main roles of MCH handbook. One is no one left behind, today's main topic. To improve the social inclusion of persons with disability, chronic disease, refugees, migrant, ethnic minorities, and the poor, etc. Another role is second role is a book of the all-in-one to promote harmonized melange of care within many health fields. For example, information from many health fields, such as maternal and child health, immunizations, infectious disease, nutrition, family planning, etc. These information from many health fields are integrated into one book. I think so. This balance between no one left behind and a book for all in one is very important because the reality might be different in each country. So this balance is important. But so balance might be different in each country. And so this is in Japan also. Now we have a bridal MCH handbook, a form of written language for blind people. It is very, very big and heavy. And another handbook is a handbook for pet, dog or cat. In Japan, Boshitecho MCH handbook is very popular terms. That's why so many pet business partners make a MCH handbook for dogs or cats. But so when we consider no one left behind, I always consider about the refugees. Because I worked in Pakistan for Afghan refugees as a UNHCR officers in 1990. I learned many things from refugees health program. And this photo is I met a father and boys of Afghan refugees. They are waiting for the doctors as a clinic at refugees camps in Pakistan in 1990. And another photo is I met sister of Kurdish refugees at camp. Refugee camp is located in Turkey, and also they are sisters of Kurdish refugees. These happened in 1991. When at that time, so I was a team leader of the Japan medical team of disaster relief, and I make I provide such a medical care to the refugees, children, mothers, and children and families. But so I'm very glad about the World Medical Association. And World Medical Association, WMA, make a recommendation about the MCH handbook. They said that WMA recommend all the medical association in the world and all the health professionals in the world. They recommend MCH handbooks to leave no one behind with respect to SDGs, especially for non-illiterate people, migrant families, refugees, and minorities, people in underserved and remote areas. So this is a very wonderful recommendation of the comment of the World Medical Association. Please you utilize such recommendation and make a negotiation with the medical association in each country. And this is a take-home message too. And Dr. Seita of the UNRWA, sorry, this slide, this photo is I borrowed from UNRWA, and mobile MCH handbook and paper style handbook for Palestine refugees. Palestine refugee mothers see the mobile phone, and in the back poster of the both mobile and paper one. Dr. Seita made a wonderful presentation on Palestine refugees program in the third webinar on last September. Paper style and digital style have a common characteristics. Common things is that to get it during pregnancy, to keep it at home, and to manage the health record by themselves. This is a common characteristics between paper style and digital style, but different things. Paper style means keepsake from parents to a child with handwriting message or personal memory. If children get MCH handbook when he or she become adult, it makes a very big bondage between the parents and the children. Keepsake. Digital style. It is easy to communicate with mothers and children in special needs by using voices or videos or some other things. And sometimes parents with visual impairment request digital MCH handbook because they can use the reading function of digital handbook. Or another parent from Asian countries, small countries, requested digital MCH handbook because they would like to utilize Google translation function of digital Japanese handbook. So this is one of the advantages of digital style. And I think, why not both? Paper style handbook keeps an all-in-one simple form, and digital handbook can cover the information to no one left behind. Why not both for us? And when we use both paper style and digital style, synergy effect will be expected. So finally, so MCH handbook is a wonderful MCH handbook, including paper and digital style, is a wonderful tool to realize the world of no one left behind. Next question is question 3 is how could we support the implementation of a uniform MCH handbook when the context is so different in each country? This is Utah State. I visited Utah to see the MCH handbook. And at that time, so McDonald-san, so he is a founder of the MCH handbook in Utah State. He said, MCH handbook in Utah State promoting Baby Your Baby program. It is an original program of your state and as a keepsake from parents to children. Because in Utah, that's also a concept of the Utah State's MCH handbook. And they make also such a very beautiful, very cute MCH handbook. But in Utah, there are some Native Americans are living in Utah State. So in their custom of the Native Americans hates photography. That's why they make a so special version of the Native Americans living in Utah States. No photo and protect the circle. I love so this special version of the Utah State's MCH handbook because health development of Utah States respect the culture of Native Americans and add a special version of MCH handbook. This is also wonderful countermeasures. Next is Cameroon. Please see the photo of the blue one is a maternal and child health handbook English version. Pink one is a French version. And in the photo at the health center, many mothers, some mothers have a blue one, some mothers have a pink ones. And English-speaking mothers can get English version. And French-speaking mothers can get French version. Cameroon is the first country publishing both French and English MCH handbook because the national language of the Cameroon are French and English. Dr. Grace Arake, he will make us a final presentation today. Dr. Arake, Grace Arake is a key person to develop and promote MCH handbook in Cameroon. I learned a lot that the language is a very important factor for MCH handbook. And next is Afghanistan. And this is a children at Afghan refugees health camps in Pakistan. This is the border of the between Pakistan and Afghanistan. Many children, so they are born at the camps, but at that time, in 1990, they had never visited Afghanistan in that moment. That is a real situation of the Afghan refugees camps. And I worked for 1 year and stayed in Pakistan, and I take care of the refugee health, and I learned a lot of things from refugees camp. And after that, in 2016, 5 years ago, I accompanied the deputy minister visiting the health center in Tokyo. He said, MCH handbook was expected to save the lives of women because maternal mortality rate was very high in Afghanistan. And he said she would like to make a MCH handbook. Thereafter, I am very pleased that please see mother and child health handbook with figures of fathers. This is a new MCH handbook in Afghanistan. I'm so pleased. So this Afghanistan's MCH handbook. And I strongly hope that MCH handbook will continue to empower women and children, and we empower women and promote health and well-being of children in Afghanistan, even in the era of the Taliban. And for the culture, I would like to show you this one. This is a dogu. Dogu is a Japanese terracotta. Japan Jomon era, we call Japanese prehistory period, dated between 40,000 to 1000 BC. This dogu was not so big, were made of clay, and dogu are small, typically 10 to 30 centimeter high. But most of figures appear to be modeled as female, and they are considered to be a representative of Mother Goddess. I think maternal and child health, MCH, is one of the most conservative health fields because pregnancy care, delivery care, and child care started just after the appearance of humanity. Yeah, that is to say from a long time ago, or a few million years ago. Only, however, medical care is a very short duration. Medical care during pregnancy and deliveries started only several thousand years ago. That's why people take care of the pregnancy, deliveries, and child care. Community people take care of the deliveries and pregnancy, deliveries, and child care. That's why MCH is one of the most conservative health fields. So, for MCH handbook, there are many kinds of MCH handbook in the world. And now, so MCH handbook is developed in more than 50 countries. I show only 16. But please see the common finding. Common finding is only 2. They are health record and information on both the mother and the child. And MCH handbook is kept at home. This 2 point is a common finding, but others are different. The size is different, color, contents, and language are different in different each countries. So, especially in the content is a healthcare service practice, food and prevention for common disease are quite different in each country. To offer a flexible tool that can be adapted to each country's needs and cultures. That's why MCH handbook is very flexible and user-friendly because it is easy to add color pages and illustrations, figures, and photos when needed, or to reduce the number of pages due to financial constraints. So MCH handbook can be very flexible. MCH handbook is a personal keepsake. It contains a record of child rearing effort carried out by mothers and fathers. So, I already said, healthcare depends on cultures and customs. So, MCH handbook also can be flexible. That's why we do not need to utilize a single worldwide basic tool. We can add many size, colors, contents, language, so many things. This is a final slide. When I visited British Museum in 2008, British Museum taught in the exhibition of Japan from prehistory to the present that Japan has successfully developed a thriving modern high-tech society while celebrating many elements of its traditional culture. I hope each country will develop MCH handbook for mothers, children, and families while celebrating many elements of its traditional cultures. Thank you very much for your kind attention and ありがとうございました.
Well, thank you very much, Professor Nakamura, for your presentation and your clear take-home messages based on the 3 questions you had before.